So how we identify intellectual disabilities is at the screening, at the first level screening itself, starting from basic developmental history. So we look at a child's, as a person, as they were growing up as a child, we look at the basic developmental history like crawling, sitting, turning, speech, all kinds of developmental milestones. So if you see that there's a significant delay over there, there is a high chance that there might be a delay or there might be a developmental delay. So until the age of 6, we don't say somebody has intellectual disability. What we call is developmental delay. So after 6 is when we start saying, when we start using IQ. And IQ is nothing but based on your abilities, overall abilities to function, adapt. Based on that, there are scores that is given based on some tests that is done, IQ tests, IQ batteries. Using that, some scores are given, and in that you're categorized into normal, below average, mild intellectual disability, moderate, severe, and profound. Okay, so on this below average is something like a slow learner. You're just slow, slightly behind your average peers. But when it comes to intellectual disabilities, there's significant impairment in your overall functioning and adaptive abilities. So there are certain milestones or certain requirements that we look at that a child has to meet at every age, right? So by the age of 6, there are certain things like a child should know how to spell basic 3-letter, 4-letter, 3-letter words. The child should know colors, should have a basic idea of numbers. They should numbers and money, like not know the spending concept of it, but money, just the idea of what is money, the value of money, right? And some things like their basic self-help skills, like buttoning, taking bath, asking for food when they're hungry, understanding between hot, cold, big, small, some basic concepts. So if they know these things, that some things that they have achieved, then we know that the child is developing normally. If we see that a 6-year-old has not achieved certain things over here, then we look at why that would have happened, or maybe this child is having a developmental delay. So we can further understand. Other thing that we also focus on and we have to look at is whether the child was not given the opportunity, whether the child was, or another, or like if the child is hearing impaired. If a child is hearing impaired and we have not identified the child is hearing impaired, and we say the child is not speaking, that's not fair. So these basic things have to be assessed before we can diagnose or give a diagnosis as intellectual disability. Yeah, so these are some of the criteria, some of the basic criteria. This is not all, but some of the basic criteria we use to diagnose it. Developmental history is the basic, that's like the first level of screening. So then you collect all the basic information first, like just primary data, name, age, date of birth, parents information in terms of parental roles, nuclear family or joint family, and when the child, starting from prenatal history, that is from the pregnancy time, how was the mother's health, and even before that we look at if a marriage was consanguineous or not, because that plays a huge role. You can see there is a huge correlation between consanguineous marriage and children with intellectual disabilities or other developmental disorders, right? Okay, so we look at that, then we look at the prenatal history, if the mother had any complication during her pregnancy, and how the birth was. Immediately after birth, one of the primary things that we look at is birth cry. Was there immediate birth cry present? If there was no immediate birth cry, then we look at how delayed was the birth cry, or like what was the reason, did the child have any other issue? So we look at that. And another important thing that we look at is whether the child had any history of fits, seizures, right? So that is huge factor, because for a lot of kids it keeps recurring. So if there's a recurring if there are recurring episodes of seizures, there's a high chance that the child might develop intellectual disability, because every time this occurs, there is sort of like a fallback to what they learned. Okay, so this is other than that, the developmental milestones that we look at is when the child started crawling, when the child turned over, when was their neck, when was the neck standing, or yeah. And speech, we look at speech milestones, like when the child first starts speaking, when did the child start asking for things, putting two words together and speaking. Okay, and even in speech, we look at clarity of speech, if we are understanding or if there is any kind of um, misarticulation in their speech. When did the child stand? When did the child start walking? When did the child start running? So these are some of the developmental milestones that we look at to diagnose this. So in the Indian setting, one of the most commonly used IQ battery is it's called BKT, Binay Kamath's test of intelligence. So that has a comprehensive overall, it gives you a comprehensive idea or evaluation of a person's intellectual ability. You have different tests like memory, you have performance tests, you have something that looks at your spatial abilities, your verbal reasoning. So there are several components in that. That's one of the major tests that we use. Then we have other tests that we use for children, or like simpler tests, that is like Seguin Fombo test, or we use the Jessel's drawing test. So, and if it's like a higher level, if you know that a person has an average intelligence, some of the tests that we would use is standard progressive matrices, colored progressive matrices. Okay, these are just some of the examples of tests that we use. If the relationship between parents. Okay, so if the child sees abuse, if the child sees parents fighting, if the child sees parents screaming at each other, abusive parents, or just a child not being given opportunities. Like there are children who grow up and they don't develop speech, they don't develop language until like 6 years, 7 years. And when we look into their history, sometimes we see that the child was not exposed. There was nobody talking to the child, right? So that is environmental factors that really plays a huge role in a child's development. A lot of times there is negligent parenting, or parents who are extremely disciplinary, so the child tends to not, like there's a lot of stress or there's a lot of pressure for the child also. So environmental factors do play an extremely vital role in the child's development of various milestones. And like a lot of times it's seen that they're not given the opportunity to pick up things. So when we ask parents, like when we're interviewing the parents, when we ask them, does your child know how to do this or how to do that, then we realize that a lot of things the parents have not really tried with the child. So they say, oh, we don't know, we've always been doing it for the child, so we don't know if the child could have developed it or not, because the child was not given the opportunity. It is seen that children learn, grasp, and develop the most up to the age of 6 years. That is why it is always emphasized to start any intervention now. Anything you want, like just basic thing, I'll give you a basic example of trying to teach speech, okay, language in a child. So the earlier you teach, the better and quicker a child grasps. Or even children with intellectual disabilities, anything and everything, the early intervention, that is before 6 years of age, that is the time that their brain is developing. So it is the best time to intervene, to help a child, to give them as much stimulation as possible. So that benefits, and you can see a fast improvement during this time, followed after 6 years also. It's not that children don't pick up, it's not that they don't learn, it's just that the rate of learning might slow down. Like up till this age of 6 years, it's crucial, it's called as a crucial period in a child's life. Not just children with intellectual disabilities or any kind of developmental disorders, even a normal child, normally developing child, it is very important that in this first 6 years the child is given as much um, inputs, as much stimulation as much as possible, so because they grasp a lot in this time. And because of this reason, it's very important to keep the child away from all kinds of negative things also, like abuse or fights between parents or a negative environment also.